My name is Omar Siddiqi. I am an assistant professor of neurology at Harvard Medical School, and I am going to talk to you today about HIV encephalitis. HIV encephalitis is inflammation of the brain due to HIV infection, and it results in something called HIV-associated neurocognitive disorder, which is just the symptoms, the cognitive effects that happen as a result of HIV encephalitis. So HIV encephalitis is caused by HIV infiltrating the brain. So the virus circulates in the body when it's not controlled, and it gets into the brain, and it gets into cells, immune cells in the brain, and it activates those immune cells, which results in inflammation. And then you get secondary damage to neurons, which are the cells of the brain. And as a result of that, that's how you get HIV encephalitis and the symptoms that result in it. So the symptoms of HIV encephalitis depend on the areas of the brain that are affected. Often there can be behavioral changes. Patients and their families will report personality changes. The patient will have an altered mood. They will also have impaired cognitive deficits, so things like attention, problems with their short-term memory, problems with doing tasks at a slow speed, something that might take an ordinary person, a short period of time, takes someone with HIV encephalitis a longer period of time because they're just not processing things as quickly because of the injury that has happened in their brain. Another problem is motor problems, meaning coordination and balance and even weakness, depending on the severity of HIV encephalitis. The diagnosis of HIV encephalitis requires several things. One thing is that HIV suppresses your immune system, so a patient can get other infections that can cause similar symptoms. So the first thing you want to do is to rule out those infections. You do various tests on the blood, on the spinal fluid, and once you've ruled those out, then you can attribute the symptoms to HIV encephalitis. And obviously the patient has to have HIV. The other thing is you do neuropsychological testing to see if someone has an impairment in the way they think, in their personality, in their memory, in their attention. And then lastly, you can do something called an MRI scan, which is an image of the brain, and you can see if it has the characteristic changes of HIV encephalitis, which is inflammation throughout the brain. The other thing is that HIV encephalitis causes this spectrum called HIV-associated neurocognitive disorder. So the acronym is HAND. So HIV encephalitis causes HAND, and there's mild HAND, which is the patient, it looks normal, but if you do nuanced testing of them, they have some cognitive deficits. Then there's moderate HAND, which is that the family and the patient can tell that they're not quite themselves. There are impairments that can be picked up. And then there's severe HAND, which is HIV-associated dementia. It's the most severe form. And that happens when patients are severely immunosuppressed. There's a lot of HIV circulating around, and they look demented, which is a severe form of cognitive impairment. But all of that is addressed and treated partially or even totally, depending if it's mild symptoms, by starting antiretroviral medications, and patients can do well. So the way you treat HIV encephalitis is to start HIV medications, what we call antiretroviral medications that target HIV. The problem with HIV is that the more virus you have circulating in your body, the more damage it can do. It results in a lot of inflammation, particularly in the brain. So you want to reduce the virus by starting anti-HIV medications. Some patients will get HIV encephalitis who are on medications because perhaps the virus has escaped or has a mutation and it's still circulating around the brain. As a result of that, you may have to change the HIV medications so that you can target it. Really, so all of it is targeted towards reducing circulating HIV virus. So patients with HIV encephalitis can do quite well if they have never been on treatment and you reduce the circulating amount of HIV virus, then you reduce the inflammation and the secondary damage that happens as a result of HIV. So they can recover. Some can actually make near full recovery. If HIV virus has been left unchecked and has caused a lot of secondary damage, and there is some shrinkage of the brain or brain injury, then a patient will have residual cognitive deficits. They'll have some impaired thinking, perhaps some personality changes, but they can recover if you get the virus in control and allow the brain to repair or to take over areas that have been impaired by areas of the brain that have been damaged. So that some of the patients can have very, very good outcomes, and some can have residual deficits depending on how much damage has been done.